Every 2 minutes, someone in the UK is diagnosed with some form of cancer. Bowel cancer is the 4th most common, and yet it is the 2nd biggest killer.
When you have cancer, you realise there's very little that's in your control.
More than 9 out of 10 cases are diagnosed in people over the age of 50, and yet bowel cancer can affect anyone at any time. 2,500 cases are actually detected in people under the age of 50.
So by the time I was diagnosed, I already had metastatic cancer.
Bowel cancer can often be fatal, but is entirely preventable with a simple procedure that removes precancerous growths called polyps from the bowel before they have an opportunity to develop into cancer. To be most effective, screenings need to happen before symptoms are present. The procedure is called a colonoscopy, and it involves inserting a tiny camera on the end of a tube into the rectum to check and remove, if present, polyps on the lining of the colon. It sounds painful and embarrassing, but in actual fact, it's one of the most simple procedures you can have. And to prove it, I'm going to have one myself. Throughout this programme, we're going to be speaking to medical experts about bowel cancer and how to fight it.
Because it's still a bit of a stigma, we're not examining enough people. As a result, we're not picking up these cancers early.
We're going to find out what it's like to face that horrific cancer diagnosis from people that know.
I honestly thought I'm not going to be here next year. Yeah.
I'll be taking their advice and putting any reticence I might have of my own to one side and signing myself up for a colonoscopy. This is the time you go. All on this week's Hot Topics. In this series, we look at hidden stories that have a big impact in the UK. And we meet real-life heroes who have first-hand experience. We'll be looking at questions like, how can one simple medical procedure save millions of lives? How does one building in London impact new inventions right across the world? Can we inspire a new generation of musicians? And just how far can we push our social care system before it collapses in the UK? Join me to find out more on the UK's biggest hot topics. I always want to get to the bottom of London's hottest topics, and this week's is no different. We know that bowel cancer is treatable and curable, so why do so many people still die from it here in the UK? Are we embarrassed talking about our bowels? I think one of the reasons that people don't get checked for bowel cancer is because it's down there. It's in the private place. It's about poo. It smells. But it can't be a reason, because as we know, not getting checked can be the difference between life and death. My first step is to talk to people who've had brushes with bowel cancer. How does it change your outlook once you've had to go through the unthinkable? Coming up, we meet 2 survivors of bowel cancer, eminent war correspondent Jeremy Bowen.
When you have cancer, you realise there's very little that's in your control.
And the bowel babe herself, columnist and podcaster Deborah James.
So by the time I was diagnosed, I already had metastatic cancer.
Both share with me their traumatic experience and give me inspiration for my own colonoscopy. Many high-profile people have had first-hand experience of cancer and now make an effort to raise awareness for others. One of these people is journalist and broadcaster Jeremy Bowen, the current Middle East editor for the BBC. In April 2019, Jeremy announced he'd undergone treatment for bowel cancer. I asked if he'd be willing to have a chat about his experience in receiving the dreaded news and his road to recovery.
I had had none of the classic symptoms. I was feeling fine. In fact, physically, I was really fit. I was in great shape. Because of the family history, I thought, I should get myself checked. And then I have some tests and I find out I've got bowel cancer. All the statistics show that men are reluctant to go to the doctor and they're reluctant to get things checked out and they leave things until they're too late. Now, I wasn't really in that category because I decided to take matters into my own hands when I didn't have symptoms. And if I had waited till I had some symptoms, things could have been much harder.
Jeremy is now a patron for Bowel Cancer UK, a charity that raises bowel cancer awareness and encourages people across the country to get checked.
If I'm in a relatively dangerous place, I somehow in my mind can preserve the fiction that I'm in control. But when you have cancer, you realise there's very little that's in your control.
Whilst men are most at risk of getting bowel cancer, 40% of all diagnoses are with women, although largely in the older age group. However, Deborah James got diagnosed at just 30. So I want to meet her, find out about her journey and what you can do to prevent bowel cancer. I know your story, but there's so many people who don't. Take me from the very beginning.
So I was working really, really hard, really busy, and then got a change of bowel habits. And I was losing weight, but I thought that's because I was working out really, really well. And it just got worse, and the key turning point was that I started pooing blood. And I remember going to my doctors, and it was fresh blood. And as a result, they said to me, oh, it's probably just hemorrhoids.
Deborah then had to wait 6 months to get a referral to see a gastroenterologist.
Unfortunately, there's a bit of a misconception that bowel cancer doesn't happen to young people, and certainly doesn't happen to somebody that doesn't tick any boxes for the risk. So nobody assumed the worst.
Then you discover you've got cancer. What was that like?
It was like the rug had been whipped from beneath my feet. The chances of survival with metastatic bowel cancer is incredibly low. It's the 16th of December, and it was just before Christmas. And I remember saying, I don't want to tell the children at the moment.
That Christmas, you've decorated the tree, the kids are opening their presents, and you don't know how many Christmases you've got.
No, I honestly thought I'm
That's
not going to
it.
be here next year. Yeah. One of the reasons that I now am a campaigner, broadcaster, and I talk about it is because it's something I'm shocked that I never knew about it. If I had an opportunity to know that I could be screened for stuff and to know that I could stop what was going to happen to me very easily, I would take it.
I'm going to take it then. You've inspired me. Listening to Deborah and Jeremy's stories really makes you think. It could be me next, or it could be a member of my family. But what it does do is it puts everything into perspective. Why would you be bothered about a doctor putting a camera up your bum when it could save your life? I'm on my way to One Welbeck Digestive Health, a state-of-the-art facility for the diagnosis, treatment and management of digestive diseases. Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. Bowel cancer, also known as colorectal cancer, affects the large bowel, which is made up of the colon and the rectum. Cells in your body normally divide and grow in a controlled way. When cancer develops, the cells change and grow in an uncontrolled way. Most bowel cancers develop from precancerous growths called polyps. I'm going to meet consultant gastroenterologist Professor Julian Tier and find out about the causes of bowel cancer.
For most of us, it starts as a little polyp, and the polyps gradually grow in size over many, many years and then turn into the cancer. It's one of the few diseases where we see this progression over time, where we can intervene and say, well, we don't have to get to this end point. We can find the little polyp and we can remove it before you've got to that point.
Julian is just one of the team of gastroenterologists at One Welbeck. Dr. Lisa Das is going to tell us more about how you don't necessarily have to be old to be at risk from bowel cancer.
So with colonoscopy, we're hoping to be able to take off polyps at an earlier stage and therefore prevent more invasive cancer happening. It is an entirely preventable disease. What we've found since the 1990s, we're finding Cancer's in younger people also, and that's affecting the ages of 20 to 49. And unfortunately, they're coming up with more difficult cancers.
As well as family history, diet is also linked to the cause of bowel cancer.
Those who have a high meat consumption have a higher incidence. Those who have a high fibre consumption have a lower incidence. When we get to our 50s, we can't change what we were eating in our 20s. So now what can we do to protect ourselves against the diseases which we develop? And then we come on to the bowel cancer screening programmes.
While still not available in the UK, screening programmes in countries like the US and Germany have seen a 37% reduction of instances of colorectal cancer.
Fundamentally, it's not to try and pick out and say, we can identify the person who's at most at risk and we should push the screening to them. It's to say, everyone's at risk. And so why don't we screen everyone? And by doing so, then we start to really make a difference to the outcomes.
We know that getting checked for cancer early can be the difference between life and death. So it's ridiculous, isn't it, that so many of us leave it so late. Therefore, should we be taking our life into our own hands? Coming up, I attend Andrew's colonoscopy procedure.
How are you feeling, right?
I speak to gastroenterologist Dr. Davinder Bansi.
Because it's still a bit of a stigma, we're not examining enough people. As a result, we're not picking up these cancers early.
And I prepare for my own colonoscopy. Oh. We're back at One Welbeck Digestive Health. This specialist clinic diagnoses and treats digestive diseases such as bowel cancer, the second biggest cancer killer in the UK. We've been granted access to One Welbeck's state-of-the-art day surgery, equipped with the latest medical technology. With 22 gastroenterologists on the team, this collective expertise is ideally suited to treat all kinds of digestive-related issues. Hello there, Andrew.
Yeah, there.
This is Andrew, and I've been given the unique opportunity to watch a colonoscopy being performed on him. I'm hoping it will give us an insight into the procedure and maybe prepare me for my own. So because you've had it before, you know the process. Just talk me through what I'm going to see when I'm in there.
Yeah, I mean, I think the start of it is always a little bit anxious, and basically there's a device called an endoscope, and that basically is put inside you. They'll take it all the way around to your cecum, which is the end of it, which is where it joins your small bowel. And they'll try and do that relatively quickly. And on the way out, then they'll be looking for polyps through the folds.
Well, I'm going to go and put my, they call it my scrubs.
Yes, yeah, you got scrubbed
So
up.
I'm going to put that on and I'll see you in there.
See you there.
Okay. Andrew, how are you feeling?
All right.
You all right? Ready to start?
Yeah.
Okay, so look, we're going to make a start.
This is Dr. Davinder Bansi, a consultant gastroenterologist here at One Welbeck, and he's going to be performing today's colonoscopy on Andrew.
During this exam, what we'll be doing is putting some air into you. You shouldn't feel too distended or bloated, but if you do, you can pass the wind out, okay? So you can fart away as much as you like if you have to, right? What I'll do is, if you want, because you've got your glasses on and you're wide awake, if you're interested, you can watch the screen in front of you as it's being transmitted. You see that? And we are approaching, I would say, the halfway mark into the colon, up your bowel. Usually all that people can be thinking about is what they're going to eat.
Yeah.
How are you feeling, all right?
All right.
Yeah, good, good.
What is it that most people want to eat when they come out?
Anything. Everything. I'm going to get Matilda just to press a little bit on your tummy, okay?
Can't get over how clear it is.
Yeah, no, the image is
The image
is
on that
amazing, isn't it?
screen,
Yeah,
it's-
exactly.
So at this stage, what's she looking for?
So here we're looking at the appendix orifice, just that divot. So the first aim is to get round and have a nice and comfortable patient, and it's only then that you then obviously start to withdraw the instrument, and then you look for abnormalities. But obviously, as you are going in, you'll pick things up.
Yeah.
So what we do next is we'll move back into the colon. these blood vessels, they're all nice, and this surface is what we call the mucosa, and that looks entirely normal. Again, a little bit of bleeding, all to be expected. One or two tiny little hemorrhoids there. You see a little slightly red appearance there.
Is that what one looks like?
Yeah, well,
I'm getting
Well,
very
that ain't
professional now. I'm
Well,
like,
Andrew.
you got the part.
So, how are you feeling?
Ah.
How are you?
I feel fine.
You feel all right?
It's all good.
Yeah. Cool. Well done.
Thank you.
Gloves off.
wow. Be me next.
Yes.
There we go. Absolutely fascinating. I think that's helped, actually, seeing it and knowing how diligent they are. I never, ever expected that screen to be so clear. I've taken this opportunity to talk to Dr. Bansi and ask about the stigma associated with the bowels and bowel cancer.
If you want to diagnose a cancer early in somebody, the gold standard test is colonoscopy. In 2015, something like approaching 50,000 people in the UK died of their bowel cancer. If some of those people had actually gone and had a colonoscopy earlier, rather than wait for symptoms, then a lot of those lives would have been saved. Forget the stigma and the social embarrassment of having it done. Go and have it done. We're not talking about people who actually have symptoms. We're now talking about a group of people who are 45 to 50. Really, you need to be thinking about having a colonoscopy so that if you are that 1 in 5 or 6 people that might actually have a polyp, then we can look at it, take it out, and your risk returns to 0.
With my own colonoscopy due tomorrow, I now have to prepare myself. The procedure requires a clear bowel, so I haven't eaten any solid food today, just liquids, and I've been given some strong laxatives. I have to empty this into 500 milligrams of water and drink it, and then I've got another 2 sachets to take as well. Oh, it smells nice. It's like drinking the sea. Well, honestly, I'm not being drama queen. I'll get back to you when something happens. Can't just go to bed. Okay, so there cannot be anything left inside me. So I'm ready for tomorrow now. Finally, the big day's arrived, and I'm checking in at one Welbeck Digestive Health for my first ever colonoscopy. It's all getting quite real now. Now you've got to go now, so I can put my very, very big pants on. Right, I'm sitting here just waiting for my Dr. Julian to come in, and all that's going through my mind is, oh my God, I hope I got everything out last night. Honestly, I can't think of anything else. Hello.
Hi.
Nice
That's
to
it.
see
Nice
you again.
Now, the issue for you really is, do you want to watch, do you want to see it on the screen, or do you want to be sleeping? And we can kind of judge it by how you're experiencing it. So to begin with, you can just take it down a little bit. If it's uncomfortable, you get a little bit more of the sedation. You
Right.
get down, feel nice and relaxed, and you wake up, have no recollection.
That sounds like the perfect solution, really,
Yeah,
doesn't
works
it? If
well.
you want a bit
Works
more,
well, yeah.
have a bit more.
We're going to take you in now, okay?
Honestly, I could have walked.
So, that is mine now.
I love you dearly. This is the time you go. Definitely had it before now. It must have been. That was truly fascinating. And I tell you what I've come out with, a huge respect for the inside of my body. Especially as girls, we spend a lot of time looking in the mirror. My goodness me, that's so much more important. And to be honest, I am so glad I watched it all because I have this new relationship with a part of my body I didn't expect to have any knowledge of, really. So it's crazy to say this, but this is a film I wouldn't have missed for the world. Oscar nomination. So normally now I would be free to go home, but Julian has allowed me to see some of the images so I can understand a little bit more of this process. Hi, Julian.
Hi. Okay.
So what have we got here?
These are little things we're looking for. So the real issue is, do we have polyps? And as 40% of us have a polyp. And here is a tiny, tiny little thing here, which is one tiny little polyp.
Yeah.
And if we remove them, that prevents you developing bowel cancer. So the chances over the next 10 years are reduced by at least 80%. Having developed one polyp, you can develop more. So I suggest we see you again in 5 years' time. Chances are you won't have another one.
Honestly, it's been the most fascinating experience.
I think most people find it much more interesting and much less unpleasant than they expect.
Can you just sign the bottom
Of course
of
I
it,
can.
please? You've got a pen over there.
Yeah.
And the nice thing is, I'm off knowing that
It's all done.
it's all done and I will never get a nasty down
No.
there.
Okay.
Brilliant. Thank you. Thank you very much. Thank you. Well, I've had a very personal look inside of myself, and frankly, it's been an eye-opener. But what it has made me feel is passionate that this killer needs to be talked about publicly, and that we should not be embarrassed because it's got to do with our bottom.
Do not feel shy about going to the doctor and saying, "Doctor, I have this problem with my poo. I think there might be blood in it."
The key thing is know your body, and if you have any concerns in terms of a change of bowel habits or whatever it might be.
So it's not to ignore anything.
It's not to ignore anything, because the earlier things are caught, the better.
If you're getting the symptoms, go today. You know, if there's nothing wrong, you've got a big weight off your mind.
We prioritise so much in our lives, don't we? But we don't always prioritise our health. And without our health, everything else is meaningless.